Welcome to the Cutting Edge Convention, a worldwide movement to revolutionize your life. No more stumbling around in the dark, wasting precious weeks, months, and years trying to figure it out on your own. Get ready for valuable innovations and strategies. And now, here's your host, Marcy Peters, the Age Backward Mentor.
Hello, and welcome to the Cutting Edge Convention, Innovations to Revolutionize Your Life. I'm your host, Marcy Peters, the Age Backward Mentor. I help smart, successful men and women step into a life they love and a body they love being in. Today, I want to introduce you to J.R. Burgess. Hi. And we're going to talk about the future of integrated medicine. So this is a really exciting topic, and he has so much to offer. So let me tell you a bit about him, and then we're going to jump into the topic. J.R. Burgess is the CEO of Regenerative Medical and MedFit, and he has a successful 27,000 square foot integrated medical center that utilizes medical fitness, functional medicine, and regenerative orthopedics to restore health and vitality. So JR, welcome. I'm so glad you're here.
Yeah, it's my pleasure. I'm really excited today.
Thank you so much. Is it Burgess or Burgess?
Burgess.
Burgess. Okay. So I might have said it wrong.
Okay.
We'll ignore that.
All good. Not many people get it right.
All right. So, JR, let's start with hearing about you and your story, how you got involved in this field.
Yeah, thank you. That goes way back. First of all, I grew up and I was bullied. I had big ears growing up. And with that, it started with the teacher that didn't like my mom for whatever reason growing up. So I had a real tough time dealing with that, and was very suicidal at a young age. So I had very low self-confidence, very low self-esteem, got really addicted to drugs and alcohol at 10 years old, just started drinking heavy. However, sports was kind of always my outlet. So that allowed me to really kind of have a healthy outlet in addition to the drinking and drugs. And I really just dove as deep as I could in that. And I remember my senior year, and I was always a nice guy. I always had a great heart, but that was kind of the only way that I could become that introvert, shy person and really have that outgoing personality. And one of my good friends his mother told him that he couldn't hang out with me anymore. And I decided, that hurt me because I was always nice and I didn't, do anything wrong. So I said I couldn't wait to prove people wrong. So I had no plans of going to college or anything like that. I was going to build water towers, which was a family business, which pays good income and is hard work. And I did that, but I was missing baseball. So I went back to college to play baseball. Really just wanted to prove people wrong that I wasn't a troublemaker or just into drinking and drugs. And, fell in love with baseball in school. And sports were my life. So I wanted to do sports management. And I breezed through undergrad, and sports were great, and got into rugby. So that really helped me have an outlet and really, let some of my anger and my communication issues, because I'd hold it in and then I would just erupt. And that wasn't good for my parents, my loved ones. I just had to really learn how to communicate. So went back to water towers after undergrad, and then came back to grad school and started training at a Gold's Gym, and fell in love with personal training. And I really liked helping people, getting them eating right, and had spent a few years there and just finished up with grad school. And I had a rugby injury that wouldn't go away. And I met a doctor who worked out there and started doing prolotherapy and then a PRP session with him. And he asked what I was going to do. And I said, I love the show The Biggest Loser. That's when it kind of first came out, and how the doctors told him to lose weight, and they maybe listen a little bit better than me as just a trainer. And I said, yeah, that makes sense. He was family practice sports medicine. He said they're diabetic, and if I gave him metformin, I feel like I was just covering it up. And he was sports medicine as well. And if they had degenerative disc disease or chronic pain, if I just gave them an injection, I feel like I was covering up the root cause of what I was giving them. So he asked me to join him as a concierge to his practice. And lo and behold, we started to take off real fast when we learned how to market. I started really getting authentic and telling my story that I faced addictions of food, drinking, drugs, all of that. And at that time, I got married and started making a lot of positive changes in my life, learning how to communicate, learning how to give up TV, less sports, less about myself. I gave up chewing. It's been over 4 years since I had my last drink of alcohol now, and just making shifts. And every shift that I made in myself, I was able to continue to help coach clients and getting better. And we just continued to grow very, very fast in creating a healthcare model that was just fitness and gym, and really integrating it, which I'm excited to talk about today, on how to get a maximum outcome from people. So that's the long of it, my brief story there in a short order of what I've kind of transpired in my life, and now what we're doing at Rejuve. I'm the CEO of Rejuve Medical, and in this time with our successful model, created a model, MedFit, a little over 3.5 years ago, and now we've helped over 40 clinics worldwide implement our model of healthcare.
Wonderful. Thank you so much, JR, for sharing your story. You know, it really does make a difference when you're able to share for the people listening, and also, you know, when you can start, you know, telling your story and being open about it as you have been. So thank you.
My pleasure.
So let's talk about your healthcare model. Why is it different from the other things that are out there?
Yeah, so we have 3 focuses, and the first is non-surgical orthopedics. From an injury standpoint, that was Dr. Baumgartner's background. A lot of traditional surgical places, that's all they do is the surgery. So we have a neurosurgeon on our team, but however, our focus is non-surgical orthopedics. So your traditional physical therapy, traditional injections, your epidurals, we do them a little bit differently than other clinics. Nerve injections, trigger points, hyaluronic acid injections for arthritis, and then we do something called prolotherapy, PRP, and then ultimately stem cells. So we attract a lot of people in insurance and try to get them moving with physical therapy, medical fitness, which I'll speak about in a second, and try to use their insurance because not everybody has cash, or the cash for some of the stuff that isn't covered yet, which is the PRP and the stem cells. And we try to get a best outcome with that. But part of our outcome is we realize, even if we do regenerative medicine or traditional medicine, that if somebody systemically is not able to heal from inside, their outcome is going to be very difficult. So we have our other part of our wing is functional medicine family practice. So when somebody comes in, whether they have knee arthritis, chronic back pain, we realize there's some factors that are going to affect their ability to heal. So we'll draw comprehensive blood labs and see, if somebody have vitamin D that's really low, going to be forced with inflammation in their body? Is their thyroid functioning properly? Because if not, they're not going to heal. They're not going to have the energy. Maybe they have to lose 20 pounds, very difficult to do if their thyroid's not optimized. And then other things. So that's kind of on the basic level. We'll look at the estrogen, testosterone, very hard to heal and recover with low testosterone, high estrogen. That's kind of the basic level. Then the next level is looking at people's gut. Are they absorbing nutrients properly? Do they have some leaky gut? Do they have full mitochondria health? So starting to look at those advanced labs, and vector cell labs we can lengthen with telomeres, which is won the Nobel Prize a handful of years ago. They're looking at, you know, heart rate variability, digital pulse analysis to see how they're absorbing the nutrients. And we look at food sensitivities. So if somebody is full of inflammation all the time, it's going to be hard to recover. So that onto gene testing to bioidentical hormones. And yeah, hard to explain the exact process that we go through, but we take it step by step in our what we call our CPAN process, where everybody comes in, we look at the basic cell health, the nutrients, the blood labs, and then we look at functionality. So even if they come for PRP or stem cell, the F is how they move. So we do a pain management scale and a functional movement screening, how they move, get them moving in physical therapy, even if it's just modalities to begin with, because they may be in severe pain. We'll get that going on. Then we'll work on the A part, which is articulation, which is the regenerative therapies, and the nerve health. Are the muscles too tight to allow the shoulder to ever be free? We'll do the trigger point injections, the perineural nerve injections, to really loosen up the money, or loosen up the muscle, the myofascial tissue within, and really allow that joint to start to move freely. And then we can go regenerate the cartilage, the tendons, the ligaments that are damaged with our regenerative medicine, such as PRP. So I know that's hard to explain on video, but we do have graphs where we take people through the entire process, step by step, and see what are they missing that could have been the leading cause of why they're in here in the first place, and how we're going to treat it comprehensively. And depending on the severity, we could see somebody just 1 or 2 times, all the way to a comprehensive pain management program without the narcotics, without the steroids or the surgery. Some people may need surgery, and that's why we have the neurosurgeon and the different things that, we may not be able to help, and some people may not want regenerative therapy such as stem cells. So we're okay by just providing the options and how we could go about treating them. So yeah, the next part was the medical fitness component. Dr. Baumgartner knew in his office visits that he would only get 15 minutes to 45 with a patient max, that it was myself, our trainers, our medical fitness specialists, we call them, that could spend 15 minutes to an hour, depending what the patient wanted and how bad or how injured they were, multiple times a week, to really start progressing them, to have coaching, accountability, support, figure out the workout plans that are suitable for them. We use a process called levels of fitness. So if somebody's just beginning, we're doing the right exercises for them. Then we get a customized meal plan. We'd obviously like to have them on our gold standard plan, but not everybody's willing to eat perfect. So we try to meet them where they're at and then improve them one habit at a time. So that's what we call our core habits process, and our levels of fitness and our phasic meal plans that are really suited to any individual, but some could be far more advanced and far more detailed depending on what they'll give us. And that was really the difference, where we started having the amazing outcomes where they're come for the injury, we're helping them internally, and then really get them moving and eating right, changing their mindset. And then as we continue to grow, we added the dietitian that could take what I knew to the next level, and the behavioral therapist. And, we had a class called Breaking Barriers, and I'm always coaching, and that was part of my master's degree. I really love psychology, so I wanted to incorporate that. But we realized some of the people that had greater needed the professional that could coach them along with that. So we created with that CFAN model between the unsurgical orthopedics, the functional medicine family practice, and medical fitness, all models that can combine to create the best possible outcome.
Wow. Okay. So you have a very comprehensive approach, and I really appreciate how thorough you are. I think I'm most curious about stem cells and PRP. Can you talk a little bit more about that?
Yeah, stem cells in PRP, and there's even prolotherapy. Prolotherapy has been around for 50, 60 years. So it makes sense in its general, and we're very close to seeing it starting to be covered by insurance. Even the PRP and stem cells, some payers are starting to pay for it just because the outcomes it's producing. There's a lot of politics and lobbying and reasons why surgeons and other entities wouldn't want it to come, so that's part of the problem. But pretty much every orthopedic group now has somebody specifically focused on these treatments. So it is commonplace now. So prolotherapy starts where we take, let's just say, chronic Achilles tendonitis, and we go in and we proliferate the skin, and we actually re-injure it with the needle, not like a severe tear, but poke holes in it, reintroducing blood flow to that area. Because when an injury becomes chronic, blood flow stops coming to that, the tissues become frayed, where when you proliferate that and introduce blood flow to it, then it can start healing and regeneration. However, prolotherapy doesn't have any growth factors to it, but in some injuries, depending on the severity, prolotherapy can help on its own. Whereas the next level is PRP. PRP is where you take your own blood, you separate the platelets that would cause the inflammation from it, and you re-inject it back into the same area. So it's your own healing and growth factors, but that is missing the stem cells. So the PRP is very, very effective. It helps a lot of people, but the next level is those stem cells those are the ones that have the most powerful mesenchymal stem cell healing growth factors that are within your body. So what that is your stem cells can be found in numerous places. We typically use bone marrow harvests through the iliac crest, through the femur, to harvest the stem cells. So we go do the bone marrow draw. We harvest the stem cells out there, and then we centrifuge them, separate the stem cells from the other blood and platelets, and then that same day, a few hours later, we re-inject back into the injured area. So it's really pretty wicked science that is amazing, and the outcomes are there. When people ask us, well, what is the difference and why should I do there? I like to look at it as 3 levels. If you have articulate cartilage arthritis, then the prolotherapy is not the best. That's best for strains, chronic pain, ligaments, tendons, right there. But if we're talking of narrowing of gap, torn meniscus, cartilage defects, articulate damage missing, or repairing a torn or ruptured tendon, then you're going to need PRP or stem cells. So when somebody comes in for, just say, again, the chronic Achilles tendonitis, we would say you may need 3 to 5 prolotherapy sessions, and that's how I came with Dr. Baumgartner. I had three prolotherapy sessions to my Achilles tendon, and that completely cured it. My hamstring, I had 1 prolotherapy and 1 PRP because I had lots of ruptured little tendons along the hamstring or ligaments that really needed a deeper repair. So that's where we did that and healed it. However, I played rugby in college baseball for numerous years. I've had 6 knee surgeries before I joined Dr. Baumgartner. So I already had this sort of OA, articulate damage to the knees, to where we did PRP, which is great for helping small meniscus tears. But if I were going to fix that articulate damage, that's where I needed the stem cells. So I had 2, because my right knee was my worst. I had 2 stem cells and completely back to the sport. On the left knee, I've had 1 stem cell back to rugby and baseball. So that's what we tell people. If you have an injury, you're looking at, anywhere from 3 to 5 prolotherapies, 2 to 4 PRPs, and 1 to 2 stem cells for any injury, depending on the severity of it.
Wow. Okay, that sounds amazing. And what is the success rate, generally speaking, with that?
We've helped 90% of all people non-surgically have better outcomes. And that can be on 2 factors. That can be on pain, mobility, or complete restoration. So that's how we kind of measure outcomes on 3 levels. So if somebody comes and just has day-to-day pain, our first goal is, how do we get them out of that pain? And along that way, with our CFAN process, we are working trigger points, we are working NORs, trying to restore functionality. But our first hope is, how do we bring that pain from an 8 to a 5 immediately? So between that 90% success rate, people are going to report either less pain, better functionality, or complete resolution of the initial problem that they came in for. And that just depends on severity. It depends on their cell health, because if somebody comes in, they smoke, they eat out all the time, or drinking soda, that's where we prep them, that your outcome is going to be much less if we don't really focus on that cell health initially. And we don't like to treat people unless they say, no, I absolutely, want to do this, and I'm not going to have surgery, but I'm not willing to give up my lifestyle. We need to be forward with them that their outcome and potential is far less than somebody who is taking the comprehensive approach to treating this.
Okay, so 90% success rate is really high. So that's amazing. Let's talk about what are some things that the people who are here with us today, who are watching and listening, what can they do to improve? What types of tips would you have for them?
Yeah, we like to tell people they are the doctor of the future. That if we are dealing with thyroid issues that we have there's something that's led to them. Now, don't get me wrong, for those listening, there are terminal things, there are cancers, there are unforeseen accidents, traumas that do happen. And that's where emergency medicine in the United States, in my opinion, is very, very good. My mother has triple bypass today. I want that to happen here. However, how we got to that triple bypass is where we all need to look in the mirror. You know, are we smoking? Do we have stress in our life? So I look at two things, and this may help, is we all have a pendulum. And I look at why our bodies are breaking down. The first is the lifestyle. Extra body weight leads to disease and degeneration. Or nutrition. That's from, are we eating the fast food, refined processed carbs, high sugar diet? Now, like I said, I know everybody can't be gold standard. Not everybody can eat organic. Not everybody can afford freshest and best food out there. But it is better for you. And it is actually more affordable when you learn how to not eat out. When you learn how to farm on your own or use the resources or people that have access to that. And then movement. Movement is medicine. For the most people that I know, they can go for a walk or get in the pool. That alone is the prevention of chronic disease in the United States. So secondarily, then, yes, resistance training. It's important. Flexibility, yoga, Pilates, core strengthening, all those things matter. So, you know, that's the next part about it is stress. You know I was so pumped that when we started the session right there, you wanted to have a mindful moment and ground me and you know, go inside of our minds and just really be present in the moment. People are on their phones 24/7. They're stressed. So there is physical, emotional, and environmental stresses that we deal with. If we want the best health benefit, then we got to learn to reduce the stress in our lives. So not being on our phone all the time. If we have strife in relationships and in work, in our all of our relationships, we have to learn to communicate. Just like I said, I had all that angst growing up. Well, I really just didn't know how to communicate it. I would let it grow in, and I had to grow. I had to grow past that. No conversation is too tough to be had. That everybody wants happiness in the life. It's just being on the same page. And ultimately, not every relationship is going to work out, and that's okay. But we can find common ground. And I'm not saying give and take and go out and divorce your partner tomorrow. I'm saying we're only going to get to a place of happiness through having mutual understanding, foundation, listening, communicating. So that's the root of almost everybody that comes into our weight loss program. They have relationships that are hurting their lives, whether it's their partners, their spouse, and everything. Some people say, why are you going down that route? Because we know that's what's part of what led to the thyroid problem, to the hormone imbalances, to the diabetes. That's a big part of it. And ignoring it is ignoring the reason why it came in the first place. So stress physically, emotionally, and environmentally. We're in the wrong environments, the wrong workplace. Life is too short. You will get a job elsewhere if you are truly looking in the mirror and how do you get better skills and try to go communicate. I'm sure of that.
You brought that up. Thank you.
Yeah. Indoctrinate hormone imbalances, those happen. So and that's because of the pharmaceutical world. If your kid grew up with acne and get put on birth control at 12 years old or whatever, that's going to play a role in our body. Yes, American medicine is the pharmaceutical side of things. And the doctor of the future understands all those have side effects, and those do make, you know, your hormones in your body are like a symphony. If one's off, if you're putting estrogen in your body, then something else is going to go off. So again, it's needed, and I'm not going to go into the vaccinations and all this other stuff right there because there's too many, you know, opinions on that. But what I'm saying is that our hormones need to be aligned. So we need sleep. If we're not sleeping the right way, our hormones, our cortisol levels are going to be off. If we're not communicating, if we're stressed, our hormone levels are going to be off. So sometimes that next level intervention isn't just, you know, eating better, exercising, lifestyle, and reducing stress and sleeping better. It is about finding the right doctor that can understand functionally what's going on. How do you get the nutrients? But as I mentioned, there's always a root cause because it's dangerous if you come in here for problem cortisol or hormones or thyroid problems, and I give you 4 supplements that are going to make you feel better today, and you don't go and fix what is now making a Band-Aid, even the Nutraceuticals, which is putting on a Band-Aid, you don't go fix the other problems, I could be impacting your health long-term in an even worse measure. So always got to get back to that root cause of what's going on. And then the last component on it is we are going to age naturally. So how do we fight that? And then genetics. That's kind of what I mentioned a little bit earlier is telomere lengthening. Nobel Prize. Please go look that up. There's nutraceuticals, things that we can do to lengthen our telomere length because we only have a certain length of our telomeres. And as we age, they shrink. And as they go down to zero, that's supposedly when you die. So we want to have longevity with our telomere lengthenings with everything that I already touched on, different nutraceuticals such as TA65. There is genetic repositioning. That is the future, but unless you're a multi-millionaire, very, very hard to make happen. So there is great future in regenerative medicine and functional medicine that we're just uber passionate about and excited to see take shape. But, you know, a lot of people always give the excuse that I don't have the time or the money for these treatments. You are going to pay it in your terms of your happiness today. You are going to pay it in terms of lack of being able to be happy with your family, medical bills, cancer, chronic disease. It's going to cost you 10 times more down the road if you don't start taking care of our health. So to me, everybody should either learn how to exercise or personal health, learn how to communicate better or get the help, because we have to pay for these things because our life, our loved ones are important. Everybody that I meet with tells me their family's one of the most important things to them. And I agree with that. It is for me too. But if I truly don't make time to exercise, to eat better, then I'm really lying to myself that my health isn't the most important. My family isn't the most important if I don't take care of myself first. So we got to wake up. We got to look in the mirror. We got to take on ourselves. And that does mean recruiting professional help. That does mean building a support system. That does mean incentivizing and rewarding, and we're not perfect, and we're going to have backslides. So everything that I'm saying, don't take it as surface as you want me to be perfect. No, trust me, I'm flawed. I still struggle with addictions and mindsets and problems, but I'm committed to a happy life for myself and for my family. And anybody that I come in contact with is I want them to have everything that they deserve in this life.
Thank you, JR. I can tell that you're very passionate about spreading the word, and you have a lot to share. Thank you so much. So I want to just disseminate it down to maybe just 3 things, like the 3 most important things that you have noticed are really making the most impact. 3 things that people who aren't able to come to your clinic could incorporate into their lives. Just 3.
3 things is the lifestyle. Everything that we do affects our health. So whether that begins on the lifestyle with making better nutrition choices, getting moving today, or starting healthier relationships that minimize the stress in your life, those would be the 3 things. You are the doctor of the future, as I mentioned. If any of those 3 things are off, you're gonna miss there. If you are seeking a professional, the second thing is make sure they are looking at it comprehensively. You cannot go get an injury treated if you're missing what's going on inside from your cell health. So any of those things that are off, not your traditional family practice, more of them are learning to do this, not your just general labs, but find a good functional medicine doctor, a naturopath doctor that is really looking at root cause analysis. Your typical family practice doctors are not getting that. Again, they're important. If you go in there sick today, or you have major chronic disease, you need that medication right now, but you got to get off that. And it's your naturopath, it's your functional medicine doctor that is going to give you that the right way. And then the third is from a surgical intervention is explore non-surgical intervention first, because a lot of it can be avoided with physical therapy, trigger points, nerve injection, and regenerative therapies. A lot of people have higher deductibles now, but when you go out and you take, meniscus out, you are going to have problems down the road, versus that can be looked at prior to. That $1,000 PRP is not going to be what that $5,000 or $6,000 meniscus surgery is, and then you'll maintain your cartilage in there. So I wish I would have met Dr. Baumgartner years before, Because even with stem cells right now, my knees aren't what they were because I'm missing half my meniscus. But at least those procedures got me back to being active, because sports has always been my outlet and my love to really help propel me past everything in my life.
Okay, thank you. So you mentioned lifestyle choices and how important those really are, and to partner with a functional, integrative type of doctor who can really look at everything and be treating the root cause, not just put Band-Aids on.
Yes.
Then if you're looking at surgery or it's suggested to you, look at alternatives, surgical alternatives, so that you don't have to necessarily be having surgery when it's not necessary. So
Yes. Try them first, because like I said, you can't go back once you take cartilage out or you do a repair right there. So it's going to cause longer damage down the road, versus you can always try the PRP once or twice. And if for whatever reason it doesn't work, then you can go to that. So don't jump to the most aggressive thing first, or conservatively, then do what you have to do.
Okay, good. Yes. And I'm curious, JR, do you have a couple of nutraceuticals that you really like that are just generally good for most people without seeing blood work? Obviously, this is a broad question, but are there things that you really believe in?
Yeah, absolutely. So I would say there's probably 5 to 7 things that I think are important for everybody without jumping into lab testing. So the first one I believe in is fiber. So fiber, not just insoluble fiber, one that is both insoluble, insoluble fiber. So it's very good in weight loss and weight management. It helps the cravings needed from maybe the refined carbs and sugars. It slows down blood sugar digestion and aids in weight loss. Fiber is what we get from our fruits and vegetables. So if you don't eat a lot of fruits and vegetables on a regular basis, supplementing with fiber can be a very good idea. The second one that I believe in is omega oils. So whether that's krill or omega-3 fish oils, I just recommend looking for one, the high EPA and DHA. So if you're missing that, don't get those from Walgreens or GNC. And I'm not a company basher by any means. Get a high quality omega if that's what you're looking for. Our omega-6 imbalance in the United States is just way over the top with corn, refined everything. Omega-3s, and that means eating omega-3 foods too. Your salmon, your sun butters, foods that can provide that right there. So an omega, I believe in probiotics. So probiotics can be a good one, and again, I mean a high quality one. So that means also different foods that have probiotics in them. So I'm always, as much as I say supplement, I'm always looking at the natural side of things. So fermented foods, sauerkraut, kombucha, yogurts that are good and clean without all the added sugars. Those are good things to do right there. Let me think. Vitamin D in the United States, we simply don't get enough. Your normal family practice doctor will tell you your levels may be normal. There's a difference between tests when we're looking at thyroid and vitamin D between normal and optimal. I want vitamin D at optimal. That's how we're going to have great energy, how we're going to have great motivation. So if I can have that vitamin D level around 80 or 90, that's what we look for. What that means is if you take 5,000 milligrams per day, you're going to be just fine without overdosing. If you're getting into the high dosing, if you're sick or not feeling well, that's when maybe it's okay to get, a 20,000 IU capsule. But on a daily basis, 1,000 to 5,000, I'm pretty certain you'd be perfectly fine unless you're Florida and below in the northern hemisphere. A good multivitamin if you don't eat the same thing, if you don't eat a diverse diet. So if you're not getting lots of fruits and vegetables, if you eat the same things over and over again, then a good high quality multivitamin will be there. Another one that I think is good is vitamin C. Buffered vitamin C, that's going to help with nutrients. You just simply don't get all that you need. It's going to help reduce inflammation out of your body. So I think that's an important one. If you're dealing with gut issues and you do work out a lot, a good glutamine is important, but that's maybe not for your everyday general person. So I just wanted to add that one in there. So those are the ones that I more commonly tell people to get on. Another common one, magnesium. I know I could go off on this all day. I'm sorry. Wrong question for me. Magnesium is a good one if we're working out. Most Americans are deficient in magnesium. So these are based on the tests that we see in deficiencies. These are the most common ones. And then, yes, a good quality protein powder, just because we sometimes lack the protein that we need. But not everybody has the dairy problems. I mean, a lot of people have inflammation from the dairy and gluten. So typically we tell people in our phase 1 meal plan to take that out of the diet just to see if they cause problems. So a good quality egg protein, or a good one with low lactose rates if you do not get enough protein in your diet.
Okay, great.
I could give more if you wanted, but I don't want to overwhelm anybody.
No, those are really good general suggestions. Thank you. And I just wanted to mention, if you are supplementing vitamin D for a while, or you have been, get those levels checked every
Tested. Always recommend that, because it is toxic at a high level, right. But just generally, yes.
Right. It is possible that you'll go too high. That actually happened to me because I was supplementing a lot. So JR, what is the future of integrated medicine? What is coming down the pipeline next?
Good. I was just at the Academy of Regenerative Practices speaking to doctors this last weekend. And the weekend before was the IOF, International Orthopedic Foundation. And the future is integrated care just like this. You will see, even in 2018, the CMS and Medicare for the first time is going to be covering preventative services. So you will see massage, dietitian services, personal training covered in the insurance world within CMS and Medicare starting next year. They do have to be pre-diabetic or have metabolic syndrome of any kind. So you are going to see preventative lifestyle and functional medicine take. You've just seen the Cleveland Clinic introduce functional medicine in there. Mark Heyman's really continuing to grow in that. So at these conferences, all are realizing that if they just go have the surgery, if they just look at the functional medicine, that they're missing the whole practice. So people are referring to doctors that are looking at the comprehensive view that can do it in there. And that's why we created MedFit as well, to actually help practices have the integrative trifecta model, because this can fit into an OBGYN practice. There's no reason they can't be doing for gestational diabetes, for postpartum. Exercise and nutrition and medical fitness fits in that model. It fits in the chiropractic model. It fits in the hospital model. But they need to integrate, and that's the future of the medicine. You can't just have a hospital and then a wellness center and them not communicate together. So these systems need to have interoperability for them to be able to treat the patients comprehensively in the best manner. So the future is, you will see integrative practices more than before, is looking at functional and lifestyle medicine, fitness, exercise, and nutrition with any other traditional medical model that we see right now. And then that next level is interoperability, where the systems communicate to each other.
Okay, that sounds great. And yes. What about other things along the lines of stem cells and PRP, or any of those types of technologies coming through?
Yeah, stem cells is going to be the continued wave of the future. PRP and stem cells, as I mentioned, there are other ways to do it. There's fat adipose, there's amnion, but out of all the current studies that we're seeing right now, bone marrow has the richest mesenchymal stem cells that are in them right there. So that's why we do it. A lot of our groups and people that I work with still do fat adipose, which is very common. It just doesn't have, based on the studies that we're seeing, the amount of growth factors, but it is better for certain procedures. So it's hard in one show to get into what each one of those are for. There are different blogs, so if anybody ever wants to reach out to me, give you some contact information at the end based on the type of injury, but for musculoskeletal, we're seeing there. But you're going to see COPD or autoimmune disease, intravenous stem cells that are coming more and more common. That's where I was at that practice this week. A lot of those doctors doing fecal stem cells, intravenous ones, really help autoimmune disease, on a high level. So that is the wave of the future. However, there is a lot of lobbying politics that don't necessarily want that to happen for, some can say the efficacy, but there's been no showing of cancer causing. There's no rejection when you're using your own body stem cells. So, it's just more of that FDA, the testing, that policies that you go through, but that is the future of it. And in our opinion, in the thousands upon thousands of cases that already happened, I think they said, and I'm misquoting the exact number, that there's been over 3 million stem cell cases already performed and no adverse side effects. Yes, there's infections that happen just like in any surgery, but from the own body's regeneration. So we do believe this is a very, very safe procedure for those clinics that are doing it on a high level basis. Just don't go to somebody that's been doing it one time. Find the advanced clinics that are doing that out there today. They are doing a great job and seeing a lot of amazing outcomes in patients. And then telomeres, as we talked about that is a wave of the future that you will continue to see, is really, that is anti-aging medicine at its finest, is actually turning back the clock on people.
Okay. All right. Amazing information. Thank you so much, JR.
Thank you, Marcy.
That we haven't talked about before we get to your free gift that you wanted to add in, and then we're going to tell everyone where they can get your gift.
Yes. So my free gift is we're going to give away our Rejuve for Life meal plan. That has the 3-phase meal plan. I talked about the gold standard a couple of times in this. That's phase 1, where it's eliminating anti-inflammatory foods from your diet and could basically help you determine, do you have food sensitivities? Do you need to go see somebody? Do you have some gut issues? Because you won't know till you go on an elimination diet. So that right there. And then also our book on CFAN. That is a much deeper dive of what to look at in cell health, the different options within functionality, the different types of regenerative procedures, more science behind what I talked about today. I just gave the brief overview versus the book has the science in the actual steps you can take. So the CFAN book, I will be giving that as a gift. That is the whole future in my mind of integrative care.
Awesome. That's so exciting. Thank you very much, JR. So I'm going to have a link for everyone to receive both of those free gifts. That sounds amazing. The website is also for JR is mymedfit.com. And so you have the website with looking at some of the blogs and research that JR mentioned. And then just click the link for the free gift. JR, thank you so very much for being here on the Cutting Edge Convention today.
Absolutely, my pleasure. Thanks for all the great work that you're doing. It's phenomenal what you're doing for health in the population in general. So keep it up.
Awesome. All right, everyone. Well, thank you again for joining us on the Cutting Edge Convention. I'm Marcy Peters, the Age Backward Mentor, and I will see you again soon for another presentation. Have an amazing day. Bye.
Thank you for being part of the Cutting Edge Convention. We don't want you to miss a single valuable session. To have the entire event available to you at any time, purchase the package now before the event ends. That's when the price goes up. And watch your emails to get your next steps from Marcy.